So today's the second part. Last time I talked about my son, why I do this holistic chiropractic stuff that I don't do really chiropractic anymore. I do mostly holistic medicine and functional medicine as well too. That's what we talked about last time. So now I'm gonna go back further, tell you a little bit more history of my, why I become a chiropractor. So it goes back to very beginning where I was going to, I was in high school. And at that time I'm sort of lost. I don't know what to do. My GPA wasn't exactly 4.0. I do well, but not the best. And I don't know what to do. And so my mom sort of said, "Oh, your uncle is his engineering. He does so much, makes so much money in Taiwan." So I thought, why not? Okay, I'll go for engineering. I'll try it out. So I went to Cal Poly Pomona. For 3 years, I studied engineering, and it was just horrible. And why is it horrible? Because first of all, I am not an engineering brain. I cannot think logically. Physics, you name it, dynamics, calculations. It's just not my forte. So I failed miserably in one of the classes called aerodynamic or something like that. I just could not pass it. And I told myself, and on top of that, at the same time, just thinking that I will be spending the rest of my time maybe sitting at a desk doing calculation, or maybe sometime maybe on the road doing calculation, and I just cannot. I can't take it because I am not a calculation guy. And later on, I found out after I went to the chiropractic medical school that I realized I am a very artistic person. I'm very artistic on my brain. Everybody has different brain, right? Some is left brain, some is right brain. Left is more analytical, like engineers. Right is more artistic, like artists. So I am more artistic. I like to create things. I like to go with the flow. I like to just enjoy and be passionate and create different things, which I'm doing now. A lot of things that I do in clinic, technique, the way I treat patient, a lot of them I integrated all different technique and I create into my own techniques. So that's a creation that I didn't know when I was back in Cal Poly. So back there, I changed from engineering, went to biology, and I was there for about 2 semesters. I realized it's nothing much you could do except be a teacher or a researcher. So anyway, so I changed again to kinesiology, which is the sports medicine part and allied health part of the kinesiology. And when I shift to that major, I loved it. The part with biology, with human physiology, with human anatomy, with studying the medicine, how to heal certain injuries, studying the bones, the function of the muscles, how the body works to heal, what kind of method to heal, how to heal how to help the athlete to improve and get better on the battlefield, the sports battlefield. I'm just loving it. And after I graduated, as an allied health kinesiology, I don't know what to do. I don't want to be a sports guy because I'm not that great at sports. I don't want to be a teacher because I don't like to. I don't think I'm that teacher type for sports related issue. So my mom sort of kind of tells me maybe you should go volunteer in certain places, which I did. So I volunteer in the physical therapy office, volunteer in the chiropractic office, volunteer at different clinics and different hospitals. And I realized physical therapy in the hospital, all they do is they kind of have people do exercises. That's all they do. people in the hospital, it doesn't seem like they enjoy the session with a physical therapist. Maybe that's the way I see it. Maybe I'm not right. Could be some other, you know, stuff happening in the physical therapy world, but I didn't see that. So I went to the chiropractic. I visited Dr. Shea and a few other chiro, and then what I see from patient is that their response from the doctor's treatment, it's really just amazing. It's where the patient, because when I volunteer for Dr. Shea, he just basically tell me just to sit there and watch him treat patient. So I was, for example, this is a room here. I would sit right in the corner and I would just watch how he treat patient, how he interact with patient. And every time in between patient, he will leave right after patient's gone, right? So patient comes in, wait for the doctor. I am in the same room with patient. So I start asking different patient different questions, how he feel getting therapy, chiropractic therapy by Dr. Shea, and they all responded very well, and they all say, I'm glad he treated me, I'm glad he, maybe he changed my life, I'm no longer in pain, and they said they wouldn't know what to do without him. So I was like, this is it, this is what I want. I want to have patient get better. I want to see the happiness in patient. I want to change patient's life. I want to change people's life with what I do. So from that moment on, I decided I want to be a chiropractor. So I applied for the school. I got in, and right before I become a chiro, I was just so, how do you say this? So envy that people can wear white coats. I was watching doctors go to school, look at the school, and see how the students, they graduate and they wear white coats and they help patients. I was just so envious that they could do that. And before I went to the chiropractic medical school, I don't even know if I could, if I'm capable even to become a doctor. So I applied for the school and I got in. And for 4 years, I studied really hard because it's very, very hard. It's very, very difficult getting through these 4 years. It's very, very, very difficult. But I got through it, got my degree. And then, there's a lot more story. Maybe I can tell you in the next episode. Okay? So here I am. I'm happy. I'm content. I'm very happy that I am a chiropractic physicians. I can help so many people with so many different conditions. I can do everything except I cannot do injection. I cannot give medication. That's the only thing I cannot. That's the only two things that I cannot do. I can do everything else. I can help with every single condition known to man. That's why I'm here. I'm very, very happy that I can do this until I die. I was telling people, my friends in church also, and my wife, of course, that I will help patient to my very last breath. One time I saw a movie about a Korean, or I think it was Korean drama. He's an acupuncturist, and he was, needling patient since he was young, in his 20s, and then even on the very last day of his breath, he was needling patient, and he just died with patients sitting beside him. After seeing that TV drama, I'm like, that's the doctor I want to be. I want to help patient. I want to get patient better. I want to give my entire life to get patient better. No matter how old I am, no matter what condition I am, that is my calling. That is my job. That is my passion, to get people better, to help people on their way. All right, that's my story, and I will tell you more in the next episode if you're interested in knowing more. Great, thank you so much. I'm Dr. Lin. Remember, please to press that like button and then subscribe. I'll see you next time.